The state of Nebraska has many flaws in its drug sentencing system. Offenders are being sentenced to harsh times for small offenses, and our prison population is aging. The state must identify what they are doing that is lacking, including their current policies. To create a better justice system, we must examine our future of drug sentencing. From the early days of our country, drug use was the norm. In the 1890s, Sears offered cocaine syringes for $1.50. It was the norm to order your cocaine from the same catalog as your home furniture. In 1909, the first act to regulate drug use took place with the Smoking Opium Exclusion Act. In 1914, the Harrison Act regulated cocaine and opiate use. And in 1919, the 18th Amendment was created, passing a total prohibition on alcohol. In 1933, prohibition was repealed, and in 1937, the Marijuana Tax Act created a total prohibition and taxes on marijuana, hemp, and cannabis. The well-known Bayer company that commonly produces over-the-counter medicine today used to advertise their heroin as your over-the-counter cough medicine option. It was the cheapest relief for your cough. Another company called Lloyd offered cocaine tooth drops as their best cure. They encouraged children to use their cocaine drops to feel better. They were an instantaneous cure. In 1970, President Nixon officially signed the Controlled Substances Act, creating the 5 schedules of drugs, chemicals, and substances that we still have in existence today. In 1971, President Nixon officially declared the infamous war on drugs and named drugs as public enemy #1. His policy chief was famous for stating that the Nixon campaign has 2 enemies, the anti-war left and black people. In 1977, President Carter took office and attempted to make drug sentencing reform. He officially decriminalized 1 ounce of marijuana, but many of these efforts were taken back when President Reagan took office, and he and his wife Nancy launched the Just Say No campaign, highlighting the dangers of drug use, leading to the very beloved DARE program. In 1986, Congress officially passed the Anti-Drug Abuse Act, creating mandatory minimums and the 1:100 ratio of crack to powder cocaine that was in existence until 2010. As previously mentioned, the Controlled Substances Act creates schedules for chemicals, drugs, and substances. Schedule 1 have no currently accepted medicinal use and have a very high abuse potential. They are forbidden in all 50 states, with marijuana being the exception, of course. And the most well-known of these are LSD, heroin, marijuana, and ecstasy. Schedule 2 have a high potential for abuse and a potential for severe psychological or physical dependence. They range in legality, with the most prominent being Vicodin, cocaine, methamphetamines, oxy, Adderall, and interestingly, fentanyl. Schedule 3 have low dependence potential and are legal and used for many different reasons. These include Tylenol with codeine and steroids. Schedule 4 have a low potential for abuse and a minimal risk for dependence. The most prominent of these include Xanax, Valium, and Ambien. Schedule 5 have a very low abuse potential and are legal and used for many different reasons. They contain a very small quantity of certain narcotics and are commonly used as your over-the-counter medicines for antidiarrheals, antitussive, and your cough medicine. These include Robitussin AC and Lyrica. It is important to note the flaws that the scheduling system has. Marijuana is listed as a Schedule 1 drug with no accepted medicinal use. But that's not entirely true. Many states, including our own, have tried to pass medical marijuana. Fentanyl is still a Schedule 2 drug, even though it leads the country in terms of overdose deaths per capita and is inherently more dangerous than marijuana. As our federal government has declared what substances, chemicals, and drugs they deem to be illegal, states have had to create statutes to enforce these policies. The state of Nebraska has declared in Statute 28-416 that it is illegal for anyone to knowingly or intentionally manufacture, distribute, deliver, dispense, or possess a controlled substance with that intent to do so. If it is a highly dangerous drug and listed in Schedules 1 through 2, it is a Class 2 felony with 1 to 50 years imprisonment. Schedules 1 to 2 are a Class 2A felony with 1 to 20 years. 4 to 5 are a Class 3A felony with 3 years and or a 10K fine. And any substance that is not marijuana, but has no valid prescription or permission, is a Class 4 felony with 3 years and or a 10K fine. Cocaine, heroin, and meth or amphetamines have their own sentencing system as well. Less than 10 grams is a class 4 felony with 2 years and/or a $10K fine. 10 to 28 grams is a class 1D felony with 3 to 50 years. 28 to 140 grams is a class 1C felony with 5 to 50 years. And greater than 140 grams carries a class 1B felony from 20 years to life imprisonment. Methamphetamine or marijuana possession, of course, has its own sentencing system as well, as it is decriminalized in certain small amounts, even in the state of Nebraska. Greater than 1 ounce, but less than a pound, is a class 3 misdemeanor with 3 months in jail and/or a $500 fine. Greater than a pound is a class 4 felony with 2 years in prison and/or a $10K fine. And possession under 1 ounce does vary on your offense type. A first offense is simply an infraction, is a $300 fine and a drug education course. Your second offense is a class 4 misdemeanor with a $300 fine and little jail time, which typically ends up being your time served awaiting your sentencing. And your third offense is a class 3A misdemeanor with a $300 fine and 3 months in jail. As the state has strict policies imposing jail or prison time for every single drug charge, including those small possession limits, the system is becoming extremely overcrowded. Every year, the Office of the Inspector General releases a yearly report detailing the correctional system, and 2024 noted a lot of recommendations falling short. Each of our 9 Nebraska facilities is literally busting at the seams. All of these numbers are based on that 2024 report, as it was the only one available to me at the time of this paper, but those numbers have either decreased very, very slightly since then, or most likely jumped even more. The Reception and Treatment Center, located in Lincoln, currently houses 1,400 occupants and serves our offenders with substance and mental health issues. By numbers, it is the most overcrowded facility in our system. The state penitentiary currently houses 1,103 men, has maximum, medium, and minimum security. Tecumseh currently houses 1,077 men, has max, medium, and high security, as this does house Nebraska's death row, which very recently got a new inmate. The Omaha Correctional Center currently houses 778 individuals, is a very minimum security environment, has general population men, and sex offender treatment. The only female correctional center in the state is York, Nebraska Correctional Center. It is 326 women and 1 juvenile female. As you can tell, the Nebraska system is very overwhelmed, and they are currently operating at about 140% of their design capacity. They are the second most overcrowded in the country in terms of their design capacity, and first in operational. For a relatively small state, these numbers are very, very large. Within our overcrowded system, certain offenses are more prominent than others. As you can tell, with the Reception and Treatment Center, housing our substance abuse and mental health offenders is the most prominent in our state. That means our drug offenses are some of the most prominent in our state. Of the 203 drug offenses that were caught in the year 2023, 82.8% were for marijuana. The rest were fentanyl, cocaine, heroin, and other, but none paled in comparison to our marijuana offenders. In 2010, the Obama administration passed the Fair Sentencing Act. As I've kind of alluded to, prior to this act, having 5 or more grams of crack cocaine had triggered a mandatory minimum, as well as 50 for a higher threshold. This meant that no matter the circumstances of your crime, if you had 5 grams of crack cocaine, you were automatically given this many years. This law and this act changed it to state that from 5 grams to 28 grams and 50 grams to 280 grams. Also, prior to this law, we had a 1 to 100 ratio of crack to powder cocaine. This meant that for 1 gram of crack cocaine, you were treated the same as an offender with 100 grams of powder cocaine. 5 grams of crack was equal to 500 grams of powder cocaine. Following the law, this changed from 1 gram of crack cocaine to 18 grams of powder cocaine. Our ratio went from 1 to 100 to 1 to 18, and although this is a great change, it is not equal. It is 1 to 18, not 1 to 1. This matters because we are disproportionately sentencing our minority offenders at a much higher rate than our rich white offenders. Those who possess crack cocaine are typically of that minority, low socioeconomic status, while those who possess powder cocaine are typically rich white individuals. This is not an equal justice system in any shape, way, or form. In 2018, the Trump administration passed their own FSA called the First Step Act of 2018. This had 3 major components that included a risk and needs assessment, ensuring all offenders were being placed in the proper treatment and programming. It had sentencing reform for some certain federal offenses, and it allowed for retroactive sentencing. This was important as prior on that other act, it did not include this provision. This meant that offenders who were sentenced under the old law, it did not have a way to petition their offense. This act allowed them to say, hey, that's not fair, the law changed, I deserve a new sentence. And many, many offenders did receive a new sentence because of this law. The Sentencing Project found that from 1980 to 2018, drug convictions grew from about 19,000 to 183,900. The Nebraska prison population has boomed in the last decade, even pre-COVID-19. They've been providing release to inmates who may not be safe for the public, but they need beds cleared up in their system. One of the most prominent cases of this overcrowding release is Nico Jenkins. Nico came from a family of abuse and alcoholism and had been in 17 different foster homes by the age of 13. He had a very low IQ and was diagnosed as bipolar and schizophrenic by many different individuals. He originally came into contact with the Nebraska Department of Corrections in 2003 when he committed armed robbery. In 2005, he served his first bout of solitary confinement, and from July 2011 to 2013, he served a total of 742 days in solitary confinement. During this time, he had had dreams that an Egyptian god named Apophysis, or Apep, had told him to hurt himself and hurt others. This included, but was not limited to, mutilating his face, his penis, and trying to harm Nebraska correctional staff. At his parole hearing, he had stated that he did not feel safe, and he would kill people if he was released. He had tried to seek an emergency placement in a proper facility immediately following his release, but the Nebraska Department of Corrections did not file his paperwork, meaning he was released out onto the streets with these severe delusions. Within a very short span of time, Nico killed 4 individuals: Jorge, Juan, Curtis, and Andrea. At his new sentencing hearing for these 4 murders, he blamed the Nebraska Department of Corrections for their obvious failures and showed the weaknesses of the system. He told them that he did not feel safe and he will kill people if he was released. Lo and behold, he killed people when he was released. This case is one of the most prominent in our system, and it shows that we have obvious weaknesses in how we are sentencing our most populous offenders. Based on the research provided, it is obvious that Nebraska has a faulty drug sentencing system. They have many aspects that are not working, and mass incarceration is at an all-time high. In order to have an equal justice system, Nebraska must take their inspiration from other states. The Department of Corrections has seen a budget growth of about $246 million, and the state of Colorado has requested another 427 beds for their next fiscal year. Over 10% of their admitted people are past or within 10 days of their parole eligibility date. Seeing these massive numbers, the state of Colorado recently passed House Bill, the Appropriate Use of Prison Beds Act. This amended a lot of their old Colorado law that was creating their mass incarceration. Old law has stated that the parole board was allowed to deny release to an inmate, even if that inmate was low risk, had good conduct, had a good plan, and parole was recommended. They changed this bill to state that an inmate needs to have a plan prior to their hearing, meaning it is less likely to get denied. And for the imposition of a Class 5 or 6 felony, before a sentence of imprisonment will be allowed, they must prove that all other options have been tried and failed, or a risk to the public must be apparent. If the offender is within past or 90 days of their parole eligibility date, then they must be heard urgently. They also stated that the community parole officer should always make referrals for treatment and programming, and the least restrictive means should always be used. They stress the need for release for inmates who are close to or past their parole eligibility date. With Colorado as my model, I have created my own sentencing legislation that the state of Nebraska can use. This first section is my legislative declaration. This states that the DOC is facing a correctional crisis, and they're currently operating at about 16% above their maximum capacity. A new $300 million prison is currently being constructed in Nebraska to replace our old state penitentiary, but no beds are being added. And it is important to note, the writing of this paper, it was $300 million, but that has since jumped to about $500 million, and is projected to grow as the price of everything is projected to grow. 14% of our prisoners are serving time for drug offenses, and are some of our clientele who are most likely to succeed on the outside. A significant percentage of our correctional clients can function in the community, but are taking up beds in an overcrowded system. Section 2 is the availability to provide conditional release. This states that Colorado has recently proposed conditional release options. They have stated that prior to a class 5 or 6 felony, the court shall determine if prison is the most suitable option. All other sanctions and services must have been tried and or failed, or a risk to the public must be apparent before imprisonment will be allowed. If that offender is within or past 90 days of their parole eligibility dates, then the council shall notify them, and they shall have the opportunity to have a hearing within 35 days and impose an alternative sentence. This bill is a great example of what Nebraska can do to solve the prison system. If more options are available to one of Nebraska's biggest offenders, our drug users, then treatment can be offered over imprisonment. Offenders can seek adequate treatment and programming in their community, and our risk of recidivism decreases as well, as you can continue to live your normal life while you are seeking the appropriate help you need. Section 3 is a revising of subsection 3 of statute 28416, which is that previously mentioned statute about it being illegal to have drugs. I have changed to state that from anyone caught having a substance that is not marijuana shall be guilty of a class 4 felony, to for a first offense, they shall be guilty of a class 1 misdemeanor and eligible for conditional release programming. For a subsequent offense, they shall be guilty of a class 4 felony. Section 4 is a revising of another subsection of that same statute, which is a bunch of sentencing enhancements for certain offenses. I have changed it to state that from anyone caught convicted of a violation of this section, being punished by the next higher penalty classification, to for any first conviction in non-violent offense, the court shall impose conditional release programming unless it is not available or a public safety is at risk. If not available, then the next higher penalty classification shall be imposed. Section 5 is a revising of subsection 2 of statute 292260, which is basically a discretionary power for the court. I've changed the language to state that a court may withhold to a court shall withhold a sentence of imprisonment unless there is evidence to believe that all other options are not safe or available. This change is very simple, but it basically states that you need to do this, not you shall do this, because you haven't been doing it in the past. Many of the laws and policies in place across the country and Nebraska are due to the war on drugs. A system of politically racist policies has created acts that discriminate against certain groups of people. We saw this with the 1909 Smoking Opium Exclusion Act, which targeted Chinese immigrants who commonly smoked opium. The United States people were concerned that immigrants were taking their jobs, and they wanted to find a way to ensure that could not happen. The Harrison Act was passed targeting cocaine and opiates, typically associated with black individuals. Experts had claimed that most of the attacks upon Southern white women were the result of cocaine-crazed black people. In 1937, the Marijuana Tax Act was created, with the then Commissioner of the Federal Bureau of Narcotics stating, "I wish I could show you what marijuana can do to degenerate Spanish-speaking residents." The effect of these policies shows the frayed wires of our criminal justice system. Nebraska is hanging on by the threads, and they are going to tear. Their sentencing structure reflects the traditional view reflected during the war on drugs, rather than rehabilitative-based practices. As scholar Sean Stanek stated, the criminal justice system has focused on conservative views that emphasize incarceration over rehabilitation and treatment. To move towards a better system, Nebraska must examine its current system's flaws, explore the progress they've attempted to make, and implement measures that prioritize a model of rehabilitation over punishment, including the legislation that I have proposed.